Peer check off video number 2. Hello, Olivia. My name is Trisha. I'm with Respiratory Care. I'm just using some hand sanitizer on my hands right now, so hopefully my hands aren't too cold for you. Looks like the doctor's ordered some medications for you. Looks like you've had kind of an asthma exacerbation, what we call the asthma. Have more difficulty breathing, shortness of breath maybe, a little bit of wheezing. Do you feel when you breathe? Okay.
Yeah.
So we're going to do some medications. Have you ever done any breathing treatments or any types of medications in the past?
No.
Okay. So the first one we're going to use, it's a form of albuterol called Xopenex. I don't know if you've ever heard anything about albuterol. Sometimes albuterol can kind of make your heart race a little bit, make you a little jittery, nervous. This Xopenex has a limited, not quite as bad. It won't raise the heart rate as much as it would a regular form of albuterol. So we're going to try this Xopenex here. This one we do about 4 times a day. And we'll get that going in just a minute. I'm just going to get some vital signs from you. I'm going to listen to your heart first, okay, or your lungs first. Good. Good, big breaths. Listen to your side here. Good. Very good. Yeah, and I do hear a little bit of wheezing going on in those lungs here. And get your pulse. I'm going to put a little device on your finger and get your oxygen level of your blood right now. Okay. So, any questions about the medication before we get started?
No.
Okay. I'm going to turn this on. When you're doing this, breathe nice and easy and regular breathing. Just take a couple deep breaths in every 3-4 breaths, okay? All right, I'll hand that to you. Seal your mouth tighter on that mouthpiece. Turn on that oxygen. And these treatments take about 10 minutes or so to complete. Okay, very good. All right, so then I'm going to get your vital signs again, see how we've treated or how we've done with that medication. Do you feel like it's helping breathe a little bit easier?
Yeah.
Very good. Excuse me. All right. Just taking a little, feeling that pulse again, and that's good. It hasn't raised it much, so that's a good thing. And then get your oxygen level again here. Very good. Okay, so that's one medication. There's another medication doctor would like you to start. And this one is just a little bit different here. This one is it's called Foradel, and it's more, this medication that albuterol, the Xopenex that we used, is more slower acting, or I shouldn't say slower acting. It doesn't last as long. So you're going to get just a few hours of relief for this one, whereas the other one, this Foradel, you will get longer action, about 12 hours of duration for this medication. So this one we do twice a day. Albuterol, the Xopenex, we'd only do about 4 times a day, every 6 hours. Sometimes 3 times a day, typically 4 times a day. So with this one, this is a little inhaler pod here. We are going to open this device. We're going to place a little capsule of medication in it. Push that down on there, and as you see, there's 2 little buttons on the side here. We'll open this mouthpiece. We'll push those 2 buttons together at the same time. It's going to pierce that little capsule and get that medication into the chamber here. Then you're going to take a big breath out, get all the air out you can from your lungs. Then you're going to seal your mouth around the mouthpiece. Take a big breath in. Hold that breath for 10 seconds, and then you'll breathe out you'll move this inhaler away from your mouth, and then you'll breathe out nice and slow, okay? So we're going to push those 2 together. Do you hear that capsule pierce a little bit? Take that mouthpiece off here for you. Big breath out for me. And seal your mouth around that mouthpiece. Big breath in. Good and deep. Hold it for 10 seconds. And then we'll pull it away from your mouth and breathe out for me. Very good. So now I'm going to have you take a big breath in. Big breath out. After the end of the big breath out, give a good cough for me. Good. How are we feeling now? Lungs feel like you're breathing a little more easier?
Yeah.
Very good. So both of these cause that bronchodilation, that relaxation of the smooth muscle in your lungs, bringing that open for you. So, have any questions about the medications?
No.
Okay. So I'll be back in about another 6 hours before we do that treatment again. Any questions or anything you need before I walk out of the room?
Nope.
Okay. Thank you, Miss Olivia.